with Fusion Health for today's webinar, Sleep and Mental Health, Cause and Effect. I'm your host, Chad Hilliard, Membership Coordinator here at Pittsburgh Business Group on Health, and I'll be providing the introduction for our speaker today. Good mental health starts with healthy sleep. Studies show that symptoms of poor sleep, like restlessness, insomnia, and sleep-disordered breathing, not only interrupt sleep, but can quickly lead to many mental health problems and disorders. To protect your mind from developing health issues, it is essential to establish the root causes of sleep symptoms. Today, we dive into a discussion of how mental health and the sleep quality are intimately connected, and how a professional sleep evaluation can open up the door to improving your mind. Before I introduce today's speaker, I would like to ask everyone to please mute your lines until the question and answer session at the end of the webinar. There will be an opportunity to ask questions after our speaker is finished. Now it gives me great pleasure to introduce today's speaker. Dr. Jeffrey Dermer is a systems neuroscientist, neurologist, and sleep medicine physician with particular expertise in technology-enabled sleep health delivery systems. Currently, he is an adjunct professor at Georgia State University Department of Health Professions and co-founder, Chief Medical Officer of Fusion Health, an Atlanta-based sleep health technology firm. At Fusion Health, he oversees the development of innovative medical systems that provide scalable solutions using platform-based technology to access, diagnose, treat, and manage sleep problems and disorders in large populations. Prior to Fusion Health, he co-founded Fusion Sleep, an Atlanta-based AASM-accredited multidisciplinary sleep medicine program that continues to serve tens of thousands of children and adults with sleep disorders. Dr. Dermer has published multiple medical textbook chapters, original research papers, and abstracts. His collaboration with multiple international clinical research teams led to the development of medical criteria utilized to diagnose and treat restless leg syndrome in adults and children. Let's start today's webinar by welcoming Dr. Dermer.
Thank you, Chad. Thank you very much, everyone, for joining us today as well. I really like to have a chance to talk a little bit about mental health in particular and its relationship to sleep, given a lot of the discussion I've heard from many of the companies and a lot of the patients actually who are learning more about this this topic and this overlap. So let me give us a little start here in terms of what our webinar is going to be about. Certainly I'm going to get us into the beginning of this in terms of some of the scientific and medical evidence for the connection between sleep and mental health and emotional health. But then after we talk a bit about that scientific evidence, which I think is important because it also helps to all of us to understand what it is we're actually talking about and why there's a relationship, I want to jump quickly into how people are optimizing their mental health using fundamentals of healthy sleep. So this is really the effect of healthy sleep on people, individuals. And then I'll transition towards the last third of our talk today, or our webinar, about how using Sleep Charge, which is our program, our center of excellence for sleep, can actually improve your overall health, not just your mental health, but your total health. And this is really how the effect of healthy sleep has a dramatic impact on organizations. So before we get into that discussion, I need to give you a little bit of a fundamental about the medical and scientific evidence for this connection between sleep and mental health. The first thing I want to start with is a discussion, really, what is mental health? We kind of take it for granted, the concept of mental health and physical health being separate, but really they are two sides of the same coin. And mental health itself really gets a lot of discussion, but also not necessarily a lot of understanding. So let's start off by just defining mental health. This is actually a definition that you can find from the United States government, from our mental health programs, from the NIH. And these three aspects really help to define mental health. It's our emotional, psychological, and social well-being. And I want to point out that first statement is really the fundamental bedrock of your mental health, because it's based on your emotions and your psychological frame of mind and your well-being socially that you actually think, feel, and act in a way that goes along with your state. It's also something that helps you determine how well you handle stress, relate to others, and make choices. And then eventually what we know from a lot of the research that mental health itself is different throughout your life as you develop, because this is really a product of what your brain and your mind, which is what you use your brain for, actually develops throughout your life. And so lots of life stage changes from childhood through adulthood and late adulthood really do help you to maintain a healthy state of mental activity. So I want to take that step into really what probably most of us relate to when we hear the word mental health, and that is disease. So, we often define health based on the disease rather than looking at health itself. And this is particularly true with mental health. There's often stigmata against people talking about their own mental health issues, or that they might even have a mental health issue. And this is often because we mischaracterize what mental health is. And our own knowledge of mental health often comes from things like mental disorders that we've heard about. So we've heard about these diseases that exist, like depressive disorders, anxiety disorders, or even bipolar disorders and personality disorders. And then there's schizophrenia and dissociative disorders and a number of others that are all defined in the Diagnostic and Statistical Manual of Mental Disorders, which is a little image there at the 5th edition. This is one way for us to characterize mental health, is based on what we know from disease. But when we talk about mental health as a way to maintain your health, not necessarily the diseases that occur, this is where our discussion today really starts. That mental health and maintaining a good mental state of mind is really based on the basic principles that create that good health. And one of those basic principles is your emotions and how your emotions relate to your sleep. And so I want to start today by talking a little bit about emotional regulation and mental health, because as I mentioned earlier, it's really about your emotion, your psychological and social well-being. And emotional regulation is the major construct that we use to determine your mental health and your level of health mentally. So what is that? What do I mean by emotional regulation? What I mean in terms of the actual neurological aspects of this is it's your ability to modify your emotion, to modify your mood based on using your cognitive processes. These are your cortical frontal lobe activity that actually helps you to reduce or increase the expression of an emotion, or to hold on to an emotion so that you experience it in a way that's appropriate and that you can actually convey then with appropriate behavior, which is sort of the construct here on the left image, which is, does the size of the problem match with the size of your reaction? So if you're matching up your problem size with your reaction, we also call this is, does the behavior match the affect? Then you're finding that your mental health is pretty stable and your emotional regulation is in check. On the other hand, if your affective state, which you can see in the image to the right, that affective state is both impacted by the way you feel about yourself, your appraisal of what's happening, and that's your internal sense of your mood, and also your regulatory abilities to dampen or increase and modulate that ability to have a reaction. So these are important aspects, because when we talk a little bit about the relationship of sleep and how it helps to regulate our mental health and our emotional regulation, it's something that we know quite a bit about. One of the things that we know is that when you are sleep deprived, there is a disconnection, an actual neurologic disconnection between that part of your brain, the frontal lobes. We also use the term executive part of our brain that actually thinks for us and keeps us online and on track and regulates our emotions, with our emotional brain. And here you see the frontal cortex is our executive brain, and a scan of the brain, and in the green. And in the orange is the part of the brain, the amygdala, our emotional brain. And what this image just simply shows is, in the same person, when they're well rested, which is the sleep control in the first image in the top of left, you see that the amygdala, which is just below it in the orange, is not as active. But when someone's sleep deprived, which is the image of the brain to the right, you see a heightened activity within the amygdala because the frontal lobe is no longer controlling that output. And so your emotional regulation state is lost. And this actually is what relates back to why sleep deprivation, just in a single night, can cause significant changes in your mental health through emotional dysregulation. So emotional overactivity or impulsiveness can result. You can actually have just the opposite, which in some cases causes blunting and withdrawal from a situation. And individuals may look depressed. They may look anxious. But also they are inaccurate in perceiving the social surround. And I'm going to talk a little bit about that because there's some really interesting research that pertains directly to the work environment. Also, we know that people who have sleep deprivation, even on a single night, but over the course of time, they start to have more inappropriate behavioral responses as a result of their inability to modulate their emotions. This is an interesting experiment that gets to the heart of one of the major issues, especially within the work environment. And that is when we interact with other people, a socio-emotional regulation of our emotions actually is important. And so this test actually was a very interesting research experiment where it's called a facial threat test, where they show a series of faces which decrease or increase in the amount of threat that the face indicates. So these are nonverbal cues about someone's emotion or picking up their social cues. And what they did with the subjects during whether they were sleep rested or sleep deprived, they put them into a MRI machine to look at their brain, similar to the pictures I showed earlier. And this is a functional MRI that shows the activity of the central nervous system when they're sleep rested and when they're sleep deprived in response to these threatening or non-threatening faces. They also looked at the central nervous system's effect on the peripheral nerves, so the heart rate variability, which you'd expect as you see something threatening, you'd probably have a higher heart rate and more of a reaction. So they looked at these two things, the central nervous system and the peripheral nervous system, in response to facial threats. And here's what they found. They found that in both cases, and I won't go through this data in a lot of detail, but just give you a sense that what happened here is that both the peripheral nervous system, based on heart rate variability, and the central nervous system, based on the MRI data, showed significant dysregulation. And the brain of someone who is sleep deprived compared to their own brain when they're rested shows a major difference in terms of their ability to judge threatening or non-threatening stimuli. And I'll just use this as an example. In the person who's rested, you see a non-threatening stimulus here really does not create much of a response in terms of heart rate variability. When it's threatening, you see an elevation in heart rate. When someone's sleep deprived, there's no difference between those two states. In fact, it's almost the opposite. You see a threatening response showed an even more increase, even more of a decrease, in the response of the heart. So this is completely dysregulated. And the same thing's true over here on the right. If you look at the green circle for the sleep deprived individuals, and when you look at the parts of the brain associated with emotion control, they are completely non-discriminatory. So threatening or non-threatening was almost exactly the same. And this is a significant finding because when you have an environment, a work environment per se, where people are interacting on a day-to-day basis, part of that interaction is associated with nonverbal cues. And this underlies the sense of well-being an individual has, as well as their own ability to work and work with other people. I want to add one more study to this mix before we move into the next section. And this is about risk judgment and sleep. And this is something that also goes to the basic mental health of an individual, that when they're sleep rested versus sleep deprived, their brains themselves change in their activity, which changes the behavior. This is a simple test that actually looked at someone's ability to actually attend, as well as to make a risk-based decision, something on a gambling risk task actually. And then at the end of the research, they asked the same people that took the gambling risks, what was their perception of their risk? Was it a high risk, a low risk? What's their judgment of that risk? And they did this both while they're rested and while they're sleep deprived. And what they found was really quite remarkable. And it actually gives us a great understanding of why places like Las Vegas gamble into the night. And that is, as you become more sleep deprived, the parts of your brain that judge your gain of something like gambling increase in their judgment of gain. In other words, you start to notice that gain is a lot more active. So I feel like I'm gaining. But areas of your brain that are involved in creating judgment of loss become less active. And so you see here a drop in the areas of the brain that judge loss. So quite honestly, when you are sleep deprived, you think you're gaining when you're actually losing. And this kind of behavior doesn't only happen with gambling, it happens with business decisions, and it happens with life decisions, and even accident-based decisions that people make in that environment. So to sum this up and bring it really back to the workplace, we know that people who are sleep deprived have much less ability to cope with their environments because of these changes in the brain. And this is one of the major regulatory reasons that people have mental health issues when they're sleep deprived. Not only do people have mental disorders, and you can imagine if you had the genetic propensity for depression or for anxiety or for bipolar disorder or any of the mental health issues, if you had that genetic propensity and you were sleep deprived just for a night, it's very easy to see how that disorder could be accentuated or even caused to fall into an area of clinical need. But what we know is that if you're just sleep deprived, you're unable to detect those verbal cues. So your EQ, your ability to understand those nonverbal cues in the environment are much lower. You're unable to discriminate between different nonverbal cues. So what someone's intention was is not understood properly. And you're also more likely to react rather than act, and take your thought process to a point where you're now planning rather than just reacting to an environment. Emotionally, you become very reactive to things like criticism, direction, and even collaboration becomes rather an issue of a personal attack in some ways because of the lack of ability to understand these cues. We're less able to creatively problem solve, and ultimately unable to manage and develop others. And this is something that's actually been covered in other journals as well as other publications in the recent past. And this is actually an image from the McKinsey report, the organizational cost of insufficient sleep, showing really that if you don't sleep well, all of these other mental capacities that lead to what we call leadership qualities in particular are diminished. So the ability to problem solve, be results oriented, seek others' opinions and perspectives, and also supporting and developing others at work. These are the things that you're unable to do because your mental capacities, which is largely due to your mental health, are affected by sleep or sleep loss. Okay, so you've seen the connection. You're getting some of this information now from the perspective of sleep and its effect on your mental health. But the one thing that we really need to talk about is that almost half of Americans right now, we know, have trouble sleeping. So that's a very large population that is being put at risk for mental health issues, with almost 80%, and in some cases more, that have treatable sleep problems going undiagnosed and untreated year after year. We know that adults should be getting about 7 to 9 hours of high quality sleep that's uninterrupted. But that's not happening, and I'll talk a bit more about that when we get to the next section. And this is one thing to note, that just one night of poor sleep compromises your mental and physical health and your ability to regulate both your mental and physical well-being. So let's talk about healthy sleep, because this is actually how we can get to the understanding of impacting mental health, is understanding what healthy sleep is. Well, healthy sleep is a combination of a number of things, but this is what healthy sleep looks like. Basically, it's the thing that recovers your mind and your brain every night. A number of imaging studies, which you see here, show the difference between a rested brain and a sleep-deprived brain. And it just shows a very clear understanding that parts of your brain that are active when you're doing things are not active when you're sleep-deprived. And it turns out that's the same for the emotional regulation system. It's the same for your mood as well as your memory system. But the other side of it is that you're also not getting the things that restore your body's cardiovascular system, immune system, and metabolic systems. So over the course of time, what sleep is doing for you on a night-to-night basis is it's giving you back what you've lost in terms of your ability to mentally recover, but also your body's recovery system on a daily basis. And so what does it do? It basically prepares you for the next day. It improves your performance at work. It helps you to become mentally acute so that you reduce the accident risks that you might have on a day-to-day basis. And that's not just physical, that's also mental health. So you're able to reduce those accident risks based on your ability to make good judgments and have good behaviors that help you succeed. It also has at the baseline a way of helping you to control things like weight and prevent illness. And as you see from the image to the left, sleep deprivation itself, for many different reasons, leads to heart problems. It can lead to metabolic problems, mental health issues, as well as cancer, which is something that hasn't really been talked too much about. I'd say probably mental health and cancer towards the bottom of this image are the two areas that we don't talk enough about. We certainly do understand the association with heart disease and cardiovascular disease, and even diabetes and a number of other metabolic conditions are well now established. But we really haven't talked enough about cancer and mental health and sleep's association with them and how they help you to avoid mental health issues and cancer if you're able to use your sleep appropriately. So let's talk a little bit about that. How do you get healthy sleep? Well, healthy sleep is something that we can define. It's defined by the neuroscientific fundamentals that we teach our residents and fellows in sleep medicine fellowships. And these are the three: sleep duration, in other words, the amount of time you sleep; sleep timing, which is when you sleep in a 24-hour period; and your sleep quality, which goes basically to the understanding that your sleep itself needs to be uninterrupted, and it needs to help you through the different cycles of REM and non-REM sleep, which are programmed for your brain and your body to recover and to restore function. First of all, let's talk about sleep duration. One of the things that I mentioned earlier, that adults should be getting between 7 and 9 hours of sleep on a regular basis. And that's something that not only I talk about, but that's something that I've heard from the NIH, from the National Sleep Foundation, from a number of well-known surveys and research studies looking across different epidemiologic groups around the world, and showing that when people sleep less than that 7-hour line, they increase their risks for a number of diseases as well as accidents and even cancer. So sleep duration is one of the major factors that across your lifespan changes, but also is a determinant of how healthy your sleep is. And it's the one we talk about most. The one we don't talk about that much, but we do at in certain instances, especially within the workforce and those who are on shift work, is sleep timing. And if you've ever been on shift work, and I certainly have as a resident, a fellow, even as a physician working in academic medicine, when you're on call and you're up at night and working at night, you know that that's not your best time to perform. You also know that during the day is probably the worst time to sleep, and it makes it very difficult for you to manage your performance as well as your health. And sleep timing is something that has become more and more of an insidious problem in our culture, as you can even note just from some of the work that people do these days. I know when I was a kid growing up, I remember 7-Eleven starting, and it was open at 7 in the morning and closed at 11 p.m. And that is no longer the case. That's now a 24-hour, 7 days a week kind of an operation. And that takes a toll on humans. And sleep timing is one of those things that does have a significant impact on your output in terms of what sleep does for you. And then the last is quality. Sleep quality is the black box of sleep, right? You go to sleep at night unless you have insomnia, or someone tells you about your snoring, or tells you you've been kicking them all night, or you notice you can't get yourself comfortable because things are uncomfortable. Your quality is suffering. And it's turned out that a lot of folks now have more quality issues than ever, largely because we've had more and more chronic diseases. that have crept into our culture, largely because people are not sleeping long enough, getting high enough quality sleep, and sleeping at the appropriate times, but also because our nutrition and our exercise levels are not what they ought to be. And so quality has become a major problem in our culture. And we know that the people have things like sleep disordered breathing, which is sleep apnea, and a number of other conditions like snoring. Around 25% of us have this issue. And we oftentimes just kind of laugh it off, or even in some cases think of it as a mark of healthy sleep. I know a lot of folks that think if you're snoring hard, you must have slept hard. Turns out that's probably not true. The snoring is one of those things that can interrupt your brain while it's in those stages of sleep. So if you think about those three elements, the way they relate to each other, which is in the formula down below, is the amount of sleep, the duration, times the quality, gives you how much good sleep you have. But if you're variable in the times you sleep, and you sleep at different times, then that divides the quality and duration you've been getting. So even if you get a good 8 hours a night and your quality's good, but you're sleeping off on different shifts, that's going to undercut the overall charge, the benefit you get from your sleep on a night-to-night basis. So now that you understand that, we can talk a little bit about how our program helps individuals and helps companies. And this is a way for us to get people the healthy sleep that I was talking about earlier. Getting healthy sleep means really you have to figure out what the individual problem is for everybody, one person at a time. But you have to do this in a way that is scalable. And it's got to be used using some technology so that we can use a large population approach. So this is really the population approach of a center of excellence for sleep. And I've worked for many years in academic medicine. Before I was at Emory University, I was at the University of Pennsylvania in Philadelphia, which is my hometown, and worked at Penn for about 15 years in the Department of Neurology and Neuroscience and pediatric sleep at Children's right next door. And what I learned there was that people would come from all over the country, basically, for our sleep care, because it was one of the best places on the East Coast. And this is what a center of excellence really is. It's bringing together all the specialties and bringing together all the necessary components so that you can solve the underlying problem and not just treat a symptom. And that center of excellence mentality is something that we've actually created, but in a program that can integrate directly into your company or into a health plan. So we built this in a way so that technology can be used to build awareness. We build awareness within targeted populations that might have specific conditions that need more support for their sleep. We can build this into wellness programs and have for a number of different navigation platforms. Also, we can integrate it with EAP programs and also build it into the medical plan so that medical members can use their benefits as part of their overall care. And this awareness campaign is done in multiple ways. There are flyers sent to homes, there are online programs, there are webinars like this, and even in live in-person presentations and group meetings that we attend as a group and have an entire program dedicated to that. But ultimately what we do is get people to the point of an evaluation. So the first step in actually understanding what a population's risk is, or what an individual in a large population's risk is getting to and quality issues that validated that have been used in medicine and circadian neurobiology for but mainly, and if we built this algorithm, so we're just within 15 questions, sensitive understanding of duration, timing, and sleep quality issues, and then give that person back some information, give them a sense of support, give them even libraries of data and information that are tailored to their thought process around what their problems may be, and then actually support them through the app itself directly with professionals, so that as you're looking at this information, you might have a question. Well, not only do you have a question, but you have 3 or 4 questions, or you might have 3 or 4 problems that you want to solve. And that professional support is there in the Sleep Charge app and you can go to it and get it by chatting with somebody, call them on the phone. You can even have a discussion through the app itself, like an email. But that individualized human support is there for everyone, and it helps people guide through the program so that they get to a personalized plan, which is the next step. And that personalized plan may involve sleep disorders, very much like we're talking about mental disorders that are medical in nature that need to be managed by medical teams that we have. And those are our board-certified sleep physicians, respiratory therapists, and polysomnographic technologists. They can handle those sleep apnea, circadian rhythm disorders, insomnia issues, and restless leg syndrome issues, and a number of others. But also, you may have disruptions. And this gets to that overlap with mental health. And that is, you might have stress, anxiety, depression, a number of other factors that are impacting your sleep. And it turns out that that's sort of the chicken and egg. Is it the stress, anxiety, depression causing my sleep problem? Or is that a result of my sleep being so impacted by something else? Or maybe it's both. So that's where we connect all the pieces for the individual and personalize a treatment plan that has medical and non-medical components to it. We can provide them all of the therapeutic and testing that is necessary, all done in the home, and it's brought to the individual, not the person going to a clinic or finding a doctor. It's actually being brought to them in the home or the workplace, whichever is more convenient. And lastly, we connect all of that information, all of those diagnoses and tests and treatments that we manage continuously on our platform. So from the very beginning, when you are evaluated with your DTQ evaluation, all the way through to your therapies, which could be medical or non-medical, they are all managed and supported by a care management team. And that care management team is backed by our board certified sleep physicians. It's a full team run by our social worker group. We have a social worker who's running that, and a whole operation around behavioral support for sleep. And these folks are not only integrating into your care when you call them, but they're actually collecting electronic data on your therapies every single night you're using them. And that helps us, through our algorithms, understand how each night of sleep is going. And if there is a problem that might be related to your therapy not working properly, or just not using your therapy enough, or some other technical issues, we can actually see that through our platform using the algorithms that we've built in to exception manage, and then escalate that to a coach who then can reach out and proactively support you for your issues. And so this is what and outcomes related to that support, so that we not only see how you sleep on a maybe a month-to-month basis, or you go to see your doctor every year, we're seeing it on a night-to-night basis. And we're integrating into your care so that you stay in a good position for your sleep, to have your sleep benefit on a night-to-night basis. And that what happens when people sleep well. Our Center of Excellence is able not only to provide the care that people need and continuously help manage those issues that are often not managed, but also we can go back and say, this is what happens to folks who sleep well. In our programs, and this is looking at sleep charge participants in the larger table here with the PM-PM comparison, this is over a 5-year period. Folks who are in our program with sleep apnea. This is just one population. This is about 1,000 people, actually, a much larger population you might expect, put into our program over 5 years, and you see the average per member per month cost of their health claims. This is hard facts from the health claims and analytics that we have. And it shows that once people get into healthy sleep patterns with sleep apnea, their healthcare costs are stabilized. What happens to folks who have apnea but are not participating? You see an increase in the cost of their care by almost 50%. Interestingly, after about year 3, 4, and 5, they kind of level out too, and that's largely because many of those folks rolled into our program. So we kind of ended up cannibalizing our control group, which happens in some cases. But that change is really remarkable, because not only do we see it in the overall cost of care, but if you look to the 2 graphs on the right, we see it in the cost of care for other conditions that these people also have. So when you treat someone's sleep, you increase their ability to control their diabetes, their hypertension, and their mental health issues. Just like we mentioned earlier, regulation of your mental health and physical health becomes much better when you're sleeping. You're able to regulate and allow sleep to do the things it does to help you. So what we see is, like in the upper graph for diabetes, for instance, the population with in blue is the sleep charge participants. And you see those folks with diabetes in our program with sleep issues show a reduction in cost from $2,047 to $937 in 1 year. And this reduction is simply related to reducing poor outcomes related to diabetes, things like heart attacks and strokes and retinal disease and neuropathies and kidney disease. By reducing the impact of diabetes on the individual through healthy sleep, we can help to reduce the cost of care and the poor outcomes associated with diabetes. And that's a comparison to folks who also have apnea in the program in pink, and also everybody else who's a non-participant in the entire group. And the same is true for hypertension. Cost of care on average $2,060 per member per month, going down to $983 per member per month. And in both these cases, for the diabetes and hypertension, you see it going below the average cost for all participants that are not participating in our program that have hypertension and diabetes. So we're driving costs down by creating healthy sleep in a population that already has an ongoing problem, a health issue, a mental health issue, or a physical health issue. And this is what really the benefit of sleep is for all of us. And this is the connection to your total coverage, your total health, not just to mental health or physical health. This is what sleep does for us on a night-to-night basis. So at this point, I'm open to questions. I know we have a little bit of time left. So Chad, I'll leave it open to the air and any questions you might have.
Sounds good, Dr. Dar. Does anybody in the audience have any questions first? Okay, we did receive a couple questions here through chat. First one is, what are the most common sleep problems you see, and how does the treatment approaches differ for those?
Yeah, absolutely. So actually, there's a big difference between sleep problems and sleep disorders. So most commonly, people complain of problems getting to sleep or staying asleep. In fact, what we call maintenance insomnia as a symptom is the most common problem people have. The other most common, second most common, is just sleepiness in the daytime and inability to stay awake at certain times of the day, and also in response to different stimuli like the afternoon. For instance, when there's a sort of circadian lull, a lot of us start to peter out. So those are the two most common symptoms. Now, the most common disorders that actually exist in our population are sleep apnea, which affects around 25% of the population to one degree or another, and insomnia. And when I say insomnia, I mean the chronic psychophysiologic insomnia, the one that we diagnose as insomnia, not just the symptom of insomnia. And that diagnosis of insomnia is under 10% of the population, so it's not as common as sleep disordered breathing, but it can be more, it's more easily recognized. So we tend to see more people complaining of insomnia. And one of the things actually to note is that oftentimes when people come in to our program and they complain of insomnia, what we actually find out is they have other sleep disorders like restless leg syndrome or even sleep apnea as the actual cause of their insomnia. And in many cases, they've been put onto medications that are used for insomnia with very bad effects. In fact, it probably makes a lot of those other conditions worse, where it can cover up the actual cause and not get to the core issue at hand, which is what a Center of Excellence for Sleep does. Good question. Thanks. Okay.
We actually had one other come through chat as well, as far as what services can you offer that support the employees who work rotating shifts, or they may have irregular schedules and long hours?
Yeah, that's actually one of those common timing problems that we actually end up having with different workforces. And we work with a number of different groups, folks who work in transportation, truck drivers, airline pilots who always have shifts involved, but even manufacturing plants and even healthcare, where people are working on these odd hours. the main issue is to understand that working off hours like that overall is just going to be difficult. That's the first thing to recognize, and to reduce the need for that is one thing we talk with employers and employees about. But we know we have a reality to this, and the reality is that some folks are going to have to be up late at night, and that's a group that we help by utilizing chronobiological tools. And what I mean by that is things that accentuate your drive for wakefulness, like light. Using light in a way that activates you during the off-night hours. So using specific kinds of light that activate the blue-green spectrum. Those are things that we can use at night to help people remain awake while they're working. We can also help them to avoid light while they're sleeping in the daytime by using specific types of glasses that reduce that impact on the retina and your visual system and create wakefulness. Another thing we can do is make sure that they're not having any other sleep disorders. So just because you're working on a shift, which could be impacting your timing, it doesn't mean that your quality itself may be a problem too. So we try to make sure that quality in shift workers, or your quality sleep, is very well organized, that you actually find out what the quality issues are. They could be environmental, actually. In many cases they are, because people are awake and alert and kind of walking around your house while you're sleeping. That's going to cause you to wake up. So the environment that we help people create is one of the factors that helps them sleep better during the day. And then managing their schedule. So another one we work with companies with is that their schedule itself should be maintained as irregular as possible. So irregular schedules are one of the major problems that no one really can handle. That's not something that our biology was set up to handle, and you will eventually have a problem. So we try to eliminate as much as possible shifts that are irregular, and if they must move and rotate, they should always rotate forward on the clock. In other words, it's much better for someone who's on the day shift to go to the evening shift. And it's better for someone on the evening shift to go to night shift, and someone on night shift to go to day shift, but not the other direction on the clock. Turns out your circadian rhythm system does not respond well to backward shift modulation so much as it does forward shift modulation. And then there's a number of other techniques and tactics that we have that will maximize your performance during your work shift, as well as maximize your sleep performance when you're not at work.
Okay, thanks for the info.
Yep.
Any other questions coming in from our audience? Okay, I actually have one question myself. Can you tell us about some of the safety-related outcomes you have or you've seen with other clients as well?
Oh, sure. Yeah, and I didn't really cover too much today in terms of the safety-related outcomes, but we've been working quite a bit with companies that safety is actually one of their key performance indicators. Trucking companies in particular maintain accident-based data, and some of the accident data is preventable accidents, and these are the errors that are often assumed to be human errors. One of the companies that we've worked with for a number of years, Southeastern Freight Lines, and they're happy to share this information, as John Pryor, their Director of Safety, actually has been on with me many times to talk about this, that over even a 5-year period, we showed a reduction in preventable accidents to the order of 69 to 75% year on year. And these are accidents that are pretty frequent, that have tens of thousands of dollars of damage, not necessarily loss of human life, which is a good thing, but these are accidents that result in damage to property. Oftentimes, and so the reduction in just accidents alone, and this started even within the first 6 months of the program that we've been working with them now for over 7-8 years, has shown really that their program itself is a safety program. Getting people to sleep better improves the mental abilities as well as physical abilities that lead to better judgment and lower accident rates. And John Pryor is often, I've heard him often say that, that's the best safety program that they've ever put in place at Southeastern Freight Lines, although it was not really designed to be one. It was really meant to to help their drivers with their sleep issues and their qualifications for their driving.
Excellent.
Yeah.
Okay, any other questions from the audience? Okay, I'd like to thank Dr. Jeffrey Dermer and Fusion Health for their information they provided us today. I want to thank everybody else for attending today as well. One final note, our Pittsburgh Business Group on Health Annual Health Symposium is right around the corner, and there is still time to register. The event takes place September the 6th, and that will be taking place at the Pittsburgh Downtown Marriott. Our theme this year is Accelerate into the New Era of Healthcare, and it promises to be a very informative and very innovative event. So there's definitely still time to register. You can go to our website at www.pbghsymposium.com for more information and to register as well. And again, thank you everybody for joining us today, and have a great day. Thank you.